Well, not long ago, nearly all surgeries for kidney cancers involve removing the entire kidney. But today, doctors at Catholic Health can offer many patients a minimally invasive procedure where they can remove just the tumor and save the kidney. Joining us via Skype is Dr. Christopher Atalla, a urologist for Catholic Health. Thanks for joining us.
Thanks for having me on the show today.
Tell us more about the procedure. Now, this involves robotic assisted surgery?
Yes, so as you alluded to, not too long ago, any tumor, regardless of the size, would result in having the entire kidney removed. That led to partial nephrectomy, where we found that you could just remove the tumor and leave the rest of the healthy kidney in place to preserve renal function and still have similar cancer outcomes. This surgery has now progressed to laparoscopic and robotic surgery, which results in patients staying in the hospital much less, much lower blood loss and improved pain control, with similar outcomes to open surgery as it was done in the past.
About how long have you been using these procedures? How long? When did it change and improve?
I'm sorry, could you repeat that?
About how long have you been able to use these procedures for things like kidney cancer?
Robotic surgery has been around for quite some time now. The robot's been used in urologic surgery since around 2000 or 2001, when the first prostatectomy was performed at Henry Ford Hospital.
So we're looking at some video right now of the Da Vinci. And for you as a surgeon, what is the advantage of using robotics like these in the operating room?
Well, robotic surgery is a progression of standard laparoscopic surgery. And the nice thing about it is that the robot can mimic your hand movements nearly one-to-one. So anything that you do will be relayed to the robot. And so it offers great precision, great minute control of things. And as I alluded to earlier, for the patient, they do much better, I think, than standard open surgery in terms of pain control, blood loss, and length of stay in the hospital.
We're watching the doctor there really watch the surgery on a big screen.
Yes.
It's not the robot that's doing it. It's the doctor that's doing the surgery.
Correct.
With the help
It's
of
a little
robot.
misleading.
It is.
It's a little misleading in that the surgeon is controlling the robot. The robot is not doing anything autonomously. It's all controlled by the surgeon 100%. So we're still a ways away from having a robot do operations for us.
Oh, let's hope so. So are
Yeah.
more patients opting for this procedure?
I think so. It's really become the standard of care to have these operations done robotically. Very few surgeons are having this done the traditional open way, just because of pain control and blood loss. I think that most patients have become familiar with the term robotic surgery and are seeking it. And so, it's something that I'm happy to offer at Good Samaritan Hospital. And patients have been doing very well with it.
Good Samaritan Hospital in West Islip, one of the 6 hospitals with Catholic Health. We just saw the Da Vinci. That is the technology that's being used at the hospital?
Correct. At Good Samaritan, we have the Da Vinci SI robot by Intuitive. And that's the main robot that most hospitals use. It does an excellent job, and it's a pleasure to work with.
So you're saying you talked about how it helps you as a surgeon, and you've also talked about the patients. There's fewer complications, less of a post-op pain for them?
Yes, I think that the patients do much better with pain control after the surgery, just because they have very small incisions, as opposed to an open surgery where they have a very large incision that is very painful, and that usually ends up having the patient stay in the hospital longer just due to pain control alone.
So recovery quicker too.
Yes, absolutely.
Okay. Yeah, are you seeing more advances in robotics? It keeps getting better as year after year.
Yes, it's definitely advancing. they've already come out with something called single site, where they're able to do the entire procedure through a single incision, as opposed to using 5 incisions to get the operation done. So that's something new. There is a newer robot that's out now. So things are advancing all the time, and it's always exciting to see what comes out next.
And we're going to see obviously more procedures that you will be able to do, doctors will be able to do, assisted by a robot.
Absolutely. More and more things are being done robotically each day.
And always talk to your surgeon when you have a question about, what type of procedure to have.
Of course, it's always important to ask questions, stay informed, and make sure that you know everything about the surgery as much as you can. And when you don't know something, feel free to ask your surgeon.
Yeah, because the technology keeps changing and we can't keep up with it. We rely on you.
Yeah. Yes, exactly. And that's our job, to take care of that.
Thank you so much for being with us again, and we totally appreciate all the information.
My pleasure. Thank you for having me on the show.
We'll see you soon.